Hi everyone, my name is Will Kirkpatrick. I am the founder and CTO of Tactile VR. And in today's course, we're going to go over AI characters and what it can do for simulation, specifically in nursing schools. Let's first go over the course objectives. So AI characters are advanced models that are capable of unlimited dialogue and emotional intelligence. So we're going to get into that very deeply. But what are the course objectives? Number one, we're going to understand what dynamic AI characters are. Number two, we're going to integrate AI into simulation scenarios. Number three, we're going to learn about enhancing bedside preparedness using this technology. And number four, we're going to learn about evaluating and adapting AI into simulation. Alright, so let's get right into it. So at this point, most people have heard about artificial intelligence and what it can do for general applications and use cases, such as a ChatGPT. But let's learn about specifically what AI can do for character development. And there's three different types of dialogue that comes with these different types of characters. And it goes from basic to advanced. So first starting off with scripted. So scripted communication is predetermined and there is no ability to adjust that communication. And it's usually presented as a drop-down menu or a selection of questions that you're only allowed to ask. So those questions are scripted responses that the patient's going to give you no matter how it is asked or when it is asked. And then there's also static behavior. So this character will not change behaviors based off of those factors that we just mentioned. This limits the independence of the user, and of course, it's non-responsive to your actions. So this is a very basic way to do communication. Then there's the second most advanced, which is scripted AI. Scripted AI is still predetermined with responses, but it at least allows basic interactivity. So typically you would use this by using vocal command or typing, and you can ask any question you would like, but of course that character is still going to respond within its strict parameters set by the system. And then lastly, there's dynamic AI. Dynamic AI is free world communication, just like if you're communicating with a human. We have dynamic conversations every day with each other, so these characters can do the same now with dynamic AI. It is the most advanced AI that you can use for communication. So what this means is it's responsive to your actions. So not only can you ask any question that you would like, it also depends on when you ask it and how you ask the question by using your verbiage. A big key factor to remember about dynamic AI characters is that they have emotional intelligence. So not only do they have unlimited dialogue, they also respond based off your performance in communication. So you as the user can change the communication dynamic by your performance. These characters also have the ability to collect knowledge from the user. So these characters can also be educated and learn from the user as the conversation goes on. And they'll be able to recall previous communications later on in the conversation as well. And then lastly, this dialogue is variable. Once again, the user has the ability to change the conversation based off their performance or based off what they talk about. So these dynamic AI characters are variable based off that performance. So it is not scripted and it's not being limited by parameters. It is a free conversation, just like if you were talking to a real human being. So at first we're going to do a preview video that briefly shows everything we just talked about. But then later in this course, we're going to go each one in detail so you understand what dynamic AI characters can do for your simulation practices. So let's get right into this video. Okay, so my first question is, if you could travel anywhere in the world, where would it be and why?
Yeah, probably New Zealand. I've heard the fly fishing there is amazing.
Do you like going fly fishing?
I love it. It's so peaceful.
Okay, and my next question is, if you could have dinner with any historical figure, living or dead, who would it be and what's one question you'd like to ask them?
I would like to have dinner with Benjamin Franklin. I would ask him how he came up with the concept of bifocals.
That's pretty awesome. Next thing we're going to do is a couple neurological tests. So I'm going to check your coordination in your upper extremities, okay? So what I'm going to do is have you touch your nose and then touch my finger.
Okay.
Very good. All right, the next thing I'm going to have you do is follow my finger.
Okay.
Great. Say tip top.
Tip top.
So once again, we're going to explain everything you just saw there in that video. But to summarize what AI characters are capable of, they are vocal command, unlimited dialogue, emotional responses, and have the ability to obtain knowledge. All right, so now let's get into vocal commands. What does that actually mean when you're interacting with a dynamic AI character? So imagine in this use case, we're using it as nursing students interacting with AI characters that are dynamic. So using vocal commands means there's no more drop-down menus, no more texting. They interact with a patient like they would with a real patient because these patients are capable of understanding complex instructions, such as if you were going through an assessment. That is what you're going to see in this video example. So the student is going to be able to just talk like they would with real patients and ask them to do various actions to assess them, such as raising their right arm up or raising their left arm up, or doing the finger to nose test as you can see here. So let's show an example in this video. All right, Michelle, can you go ahead and get up for me?
Can you clarify what you mean by get up? Do you need me to stand up and walk around, or would it be better if I just sat up?
No, sitting up's okay for now.
Sure.
All right, so can you go ahead and touch your nose and then touch my finger?
Okay.
Good. Can you follow my finger with your eyes?
Yes, I understand.
Good. Can you lift up your right leg?
Okay.
Good. Can you squeeze my hand here? Can you smile?
Yes.
Can you raise your eyebrows?
Yes.
Can you stick out your tongue?
Yes.
Can you close your eyes?
Yes.
So as you saw there, they could fluidly do the assessment without having to stop to interact with the application. We want to get this nursing student as close as possible to real world practice. So how they do that is by using vocal commands like they do with real patients. And the major benefit of vocal commands is that it's not just mimicking real world practice, it's also replicating it by using their voice, interacting with patients by doing complex instructions. And once again, there's no more clicking or texting like they are used to with PC simulations. Also, specifically with nursing students, they can independently think about what tests they should do and what questions they should ask the patient instead of having prompted questions that give them hints on what they should ask. So that gives them more independence by using these simulations as well, by using dynamic AI characters. So to compare traditional simulation, which has scripted responses and scripted communication, versus what we have now is dynamic AI characters to serve as our patients. So with traditional simulation, there's less independence, less realism, less variability, and less clinical judgment. Versus dynamic AI communication, it gives the user more independence because they have to independently think about the questions they should ask, more realism as it's actually replicating what they would do with real patients versus using a mouse and a keyboard, better variability, which gives the student more realistic practice on demand, better clinical judgment as it is allowing the user to have free world thinking and make clinical judgments themselves without an application prompting them to do so. Now let's get into unlimited dialogue. What unlimited dialogue means is I'm not limited to just the pertinent questions of that case scenario the educator has created. I can also ask any question I would like, such as how many dogs do you have, what's their names, and what's your favorite childhood memory. Once again, what unlimited dialogue does is it frees up the mind of the user. They do not have to be prompted by clicking or drop down menus or having a scripted laundry list of questions that they can only ask. This frees up the communication and improves confidence and reduces anxiety by allowing the student to practice communicating in difficult situations. So here is a video of unlimited dialogue. Hi, John. My name is Will. I'm going to be your nurse today. So, how are you feeling right now?
Hey there, Nurse Will. Well, I'm feeling like a fish that just caught a big one. Pretty darn good. But seriously, I'm doing all right. Breathing easier than before and walking around just fine. Thanks for asking, pal. Now let's reel in some more questions, shall we?
Yeah, so I'm glad you're feeling better now. I'm seeing you're off the oxygen, so that's good. So I just came in here to do a head-to-toe assessment. Is that okay with you? And I also have some fun questions to ask.
A head-to-toe assessment? Sounds like you're going to give me the full Hollywood treatment. You know, I've always wanted to be a movie star. Maybe they'll discover my hidden talent while they're at it. But sure, go ahead. As for the fun questions, bring 'em on. I'm ready to spill the beans. Just remember, what happens in this hospital room stays in this hospital room, deal? Alrighty then, let's get this show on the road.
Sounds good. So, first question is, if there is one historical figure that you would like to meet with, living or dead, who would it be and why?
Well, Nurse Will, if I had to pick just one historical figure, I reckon it'd be old Abe Lincoln. Why, you ask? Well, apart from being a great president and all, I heard he had quite the sense of humor. I bet we'd have a grand old time swapping jokes and tall tales. Plus, maybe he could teach me a thing or two about casting a line. You never know.
That's awesome. And what is your favorite hobby to do? Is that fishing?
You betcha, Nurse Will. Fishing, especially fly fishing, is my all-time favorite hobby. There's just something about being out in nature, the thrill of the chase, and the satisfaction of reeling in a big one. It's like a breath of fresh air for my soul. And speaking of fresh air, I sure do miss those mountain streams. But don't worry, I'm making the best of it here in my hospital suite. After all, every day is a new adventure. So, if you could have any superpower, what would it be and why?
Well, if I had any superpower, I think I would like to fly because I would be able to go everywhere I want. What about you?
If I could have any superpower, Nurse Will, I think I'd go for the power of healing. Just imagine being able to mend broken hearts and bodies with a single touch. Plus, it'd come in handy for those scrapes and bruises from my fly fishing adventures. As you saw in that video, the patient was talking up a storm, it was a fun conversation, and it didn't have to be related to just the pertinent communication that we want our students to do, such as in nursing school. What you just saw there was no script, no educator on the back end communicating for that patient. It is all dynamic AI. And you notice that the communication was dynamically changing based off of what the user has said. What this does specifically for nursing students is it helps them build skills to build rapport with different types of patients with different personalities. It also allows them to practice therapeutic communication. And lastly, you probably noticed that you did not have to talk like a robot for the character to understand what you're saying. Once again, what does unlimited dialogue do versus traditional simulation? Well, it gives more independence to talk freely with a character who does have personalities and emotions like real humans do, which increases the realism, which also increases the variability. And then lastly, of course, increases the clinical judgment by giving the user the ability to ask what questions they think is appropriate, not by what questions are prompted to them by the computer simulation in traditional practices. Now let's dive a little deeper into how emotional responses can change the dynamic of the conversation with these dynamic AI characters. So in this first video, we're going to see a poor performance by a student who is communicating with the patient and did not address their pain very well. Hi, Joyce. My name is Will. I'm going to be your nurse today. How are you feeling?
I'm feeling terrible. My head is killing me. Can I have my pain medication now? I don't understand why you people keep me waiting like this.
Well, I don't believe you've been waiting too long, but right now I'd rather you just do some guided imagery. We're not going to give you any pain medication right now.
Oh, come on. This is ridiculous. You're telling me you won't give me pain medication because of some guided imagery? I'm in agony here. And my vision is blurry too. This headache is driving me crazy. You need to do something about it now.
And then in the second video following this, we're going to see the exact opposite where they address the pain well, and you're going to be able to compare the two conversations and see how the emotional responses are provoked.
Hi, Joyce. My name is Will. I'm going to be your nurse today. How are you feeling?
I've been better, to be honest. This headache is killing me. Can I get something for the pain? I hate hospitals, you know. How long do I have to stay here?
Well, I'm sorry that you're in the hospital. I know that's not fun, but of course you can get something for pain. On a scale of 1 to 10, how bad is your pain?
It's an 8? No, 9. I really need something for this pain. It's unbearable. And please, don't tell me it's just a few more minutes, because I can't stand waiting any longer.
No worries. We're going to go ahead and take care of it right away, okay? I'm going to go grab your meds and I'll be right back.
Thank you, but please hurry. This headache is driving me crazy.
So as you see there, the communication now matters by the user. They can't just say whatever they want and that conversation is going to go the same way. The conversation is now variable depending on the user's performance and how they address the character and their needs. And what this does is, once again, it replicates real performance practice because it allows the student to get real communication practice with different types of personalities, cultures, and ethics in that situation. The last impressive thing about dynamic AI characters is their ability to obtain knowledge. So these characters can be taught, and they actually obtain the knowledge you give them throughout the conversation. So you could be having a 20-minute conversation with a patient, and they would be able to recall what you talked about in that first 1 to 2 minutes, for example. So in this video, you're going to see a student, once again, educating a character who is able to recall in their own understanding, not just repeating verbatim of what the user has given them.
All right, so I'm going to teach you the difference between right-sided heart failure and left-sided heart failure. Okay, so I'm going to first start with right-sided heart failure. So right-sided heart failure is when your right ventricle fails and blood backs up into the body. So blood will back up into the body and you'll get pitting edema down in your feet, for example, like you have. And then, of course, it could end up being built up into your abdomen as well. But then there's left-sided heart failure. So left-sided heart failure is when your left ventricle fails and the blood will back up into the lungs, causing lung issues and breathing issues. So you could have findings such as crackles in the lungs that we look out for example. So that's why I wanted you to know. I wanted you to know the difference between right-sided heart failure and left-sided heart failure, okay?
Alrighty, Nurse Will. Crackles in the lungs, eh? Sounds like we're getting into the nitty-gritty of heart health. Now, as for right-side heart failure versus left-side heart failure, let me see if I can break it down in a way even a fish would understand.
All right, yeah, go ahead and explain it for me. What's the difference between right-sided heart failure and left-sided heart failure?
Sure thing, Nurse Will. So, imagine your heart as a bustling fishing village. The right side of the village is where the fish come in from the ocean, while the left side is where they're cleaned, packed, and sent out to the world.
Right, so that's where the blood goes, but what happens when the right side of the heart fails? Where does the blood go?
When the right side of the heart fails, it's like the fishing village is having trouble bringing in supplies from the ocean. In this case, blood can't flow properly from the body back to the heart, causing fluid buildup in places like the legs and abdomen. This is known as peripheral edema.
Very good. And what happens if the left side of the heart fails? Where's the blood go?
The left side of the heart failure. Imagine now the bustling fishing village is having trouble sending out its catch to the world. In this case, the blood can't flow properly from the lungs to the rest of the body, causing fluid buildup in the lungs. This is known as pulmonary edema. It's like a traffic jam in your lungs. So there you have it, Nurse Will. A fishy explanation of right side and left side heart failure. Now let's hope my heart doesn't fail me like a faulty fishing rod.
All right, and then what lung sounds do we hear if you have pulmonary edema?
With pulmonary edema, Nurse Will, we'd typically hear some wet, crackly lung sounds known as rails. It's like the sound of opening a bag of potato chips underwater. Not exactly music to the ears, but it's important to pick up on these signs so we can cast our fishing nets in the right direction.
Very good. Good job. You do very well listening.
Aw, shucks, Nurse Will. Just doing my best to keep up and learn a thing or two. After all, knowledge is power, And in this case, it might even help me catch some bigger fish. Thanks for teaching me about heart health and those sneaky lung sounds. I'm all ears, like a wise old owl perched on a tree branch. Now how about we switch gears and talk about something fun? What's your favorite memory from childhood?
As you saw in that video, the character was able to recall what was taught to them, but in their own words and their own understanding, based off their own interests. So that character was recalling based off one of their hobbies, and they applied it to what they were just taught. One common concern that many have with AI when we involve it in simulation is the possibility of hallucinations. But with dynamic AI characters, it is now taken care of because we can set filters. Filters such as no knowledge given to this character, and that character will be able to foolproof any incorrect information that comes through based off what the educator has given them in the back end of the application. So that is why dynamic AI characters can be educated, they have full comprehension, and they have memory. So they are able to obtain knowledge. How can educators integrate AI into these simulation scenarios? With these 3 steps, we're going to explain simply how you can get started with integrating dynamic AI characters into your simulation practices. The biggest understanding that you will have to have is knowing how to go from traditional scripted talking to dynamic AI communication. So how you do that as an educator, instead of having scripted questions and answers, you will then have to formulate the filter such as no knowledge for this character. So giving this character no knowledge is your ability to actually moderate that patient and have them have an understanding how they should communicate to your students. So you're going to prepare the simulation as if it's free world practice, as if they are the real bedside nurse in that situation if we're talking about nursing school use cases. Another recommendation is providing the variability on various simulation key objectives. So for example, if you have a medication administration simulation, we recommend giving patients with different personalities to challenge the students so that way the simulation is not the exact same every time as it is with traditional simulation. So a key takeaway is understanding that when you put a dynamic AI character into the simulation, the user is no longer responding to the simulation. It is now in reverse where the simulation is responding to the student. So they can change how that simulation can go based off their communication performance. Now let's go over how dynamic AI characters can enhance bedside preparedness specifically for nursing students. Number 1, it closely replicates bedside experience. So they get a plethora of patients that have different personalities and different cultures, and they have to learn how to navigate through different nursing tasks and deliver healthcare depending on who the patient is. What that does is it improves clinical judgment and allows the nursing student to be people-oriented versus task-oriented, which is always a challenge for a lot of new grad nurses. Number 2, dynamic AI characters allow them to learn from their mistakes. So just like athletes, they learn from their mistakes by watching film after the game. And they watch themselves and take notes down and learn from their mistakes. They'll put notes down to get better for their next game. Well, unfortunately, nursing students have never had the luxury to learn from their mistakes. And now, fortunately, with these dynamic AI characters, they can learn from their mistakes in real time, based off how the communication goes, and not just communication, on how their actions and their interventions go as well. And then lastly, it allows them to repeat, but with variability. One challenge that we have with simulation when it is scripted is that that student can get in there and repeat it as many times as they like, and it's the same no matter how many times they repeat it, and they get good at that specific simulation. But as we know, if you are a nurse, things are unpredictable in the field or at the bedside. Just because it happened with one patient doesn't mean it could happen with the other. So we need variable simulation deliveries to our students because the bedside experience is variable. Not only will this allow your student to be more adaptable across different concepts, but it will give them more confidence when they reach the actual bedside. If you are interested in integrating dynamic AI characters into your simulation practices, then these are the key analytics that we suggest you follow. Number 1, confidence. This is the ability to track your students' confidence when they communicate with different types of personalities and see how it impacts their performance on different types of tasks that nurses do at the bedside. Number 2, track their therapeutic communication scores. See how well they get along with all kinds of different personalities and cultures. Number 3, track their professionalism. See how well they handle difficult concepts and difficult tasks with difficult patients, and see how often they stay within their professional parameters. And then, of course, task performance. See how well this dynamic AI character can impact the student's performance on their healthcare delivery, such as giving medications. Do the medical errors go up or down based off a different culture or different personality? These are the type of analytics that we recommend you look out for when you integrate dynamic AI characters. Thank you all so much for taking the time to listen to our course and learn more about dynamic AI characters involved in simulation practices. If you want to learn more, go to tactilevr.com or contact us at info@tactilevr.com to get more information and get live demos of how these dynamic AI characters can change your simulation practices. Thank you all so much for watching, and we'll see you in the next video.